So much new information every day when we're talking about the pandemic, and we're really dedicated to keeping you up to date on the facts. So as we do each Friday, I want to bring in Dr. David Winter from Baylor Scott and White Health. Good morning, Dr. Winter. Happy Friday to you.
Good morning, Morgan. Happy birthday to you. Happy Friday to you.
Well, it is Sonia's birthday, so I'll take that. We'll pass that on to her. So
I heard that, yes.
Well, you know, coming off the news that we just talked about, the first thing I want to ask you is your response to this news from Johnson & Johnson about its effectiveness against the Delta variant.
Yeah, this is important to hear, and it's important to know because this Delta variant is becoming the most dominant strain on the planet. In England right now, almost everyone there who's got COVID has got it from the Delta variant. And we know that in the last 2 weeks, there's been a 109% increase in cases of COVID in England because of that. Now, a couple of weeks ago, we said there was about 5% of folks in this country had this Delta variant. As you heard, 25% now and climbing. So we expect a surge coming up. Now, if you've been vaccinated, you're fine. All 3 vaccines work for this. If you're not, particularly in these holidays, I'm encouraging you to avoid crowds when you can, distance yourself. Please wear a mask if you're not vaccinated, and wash and disinfect your hands because it's a deadly virus and it's becoming more and more contagious and more predominant in this country.
And you just mentioned, and we've heard this over and over, that vaccines work to protect against the Delta variant and other strains of the coronavirus. But we have to think about young children. There's still no vaccine available for children under the age of 12. Obviously, we're in a holiday weekend. People want to get back to normal. What is your guidance for parents of young children?
Yeah, those kids can also get the virus. They do pretty well. Now, not all of them, so it's not guaranteed you're going to do well if you get COVID and you're young. So be careful with your kids. The younger ones, if they mask and distance, they're fine. I worry about them because they're not vaccinated. Now, the good news is Pfizer just put into a plea for emergency use authorization for their vaccine for children aged 5 to 11. Not approved yet, but the anticipation that will come true later this fall, so they'll get that vaccine available. But for kids, yeah, they're vulnerable. They can get it also, Morgan.
And a couple more questions for you here. Something that we have gotten so many inquiries about: pets. People want to know about the pandemic when it comes to their pets. What are you hearing about COVID and pets? Can humans get COVID-19 from their pets?
Yeah, the current information, remember we're still learning about this virus, but the current information says you can't get it from pets, but you can give it to pets. Dogs are susceptible, cats even more susceptible. Now they tend to tolerate it pretty well. They'll be lethargic, lay around, sleep a lot for a couple weeks and then recover. But if there's COVID in your household, you might want to keep the pets away from you because you don't want your dogs or your cats to get sick. But no, we can't get it from humans. At least that's the current information that we know as of today.
And then one more question for you. This one's not COVID related, but we are in North Texas, and another big health issue that we face here, especially with so much heat. Yes, we've got rain this weekend in our forecast, but it's still hot. It's still humid. That heat's going to return to the way it was. Do you have any advice on minimizing heat related illnesses?
Yeah, I'm concerned about that, Morgan. There were a series of deaths on the West Coast just last week from the heat out there. Our bodies don't tolerate heat if we get a little bit low on our fluid. Think about your car. Your car, if it's a gasoline engine car, if the radiator is full of fluid, it can take care of the heat very well. If you get low on fluid yourself from sweating a lot, not drinking enough water, you can also get sick, and it can even have some heat stroke consequences. So be careful with the heat. Drink lots of water. If you're sweating, drink more. Get cool when you can. If you start to get really sick and clammy, a little confused, call your doctor. It could be a deadly illness, so be careful with the heat. It's going to be a long, hot summer, I'm afraid.
Really good information from Dr. Winter. Thank you for being with us this Friday. Enjoy your holiday weekend.
Thank you, Morgan.